So, hello and welcome to today's Materia Medica Old and Forgotten Remedies. We will be talking today about arsenic iode. This is a very underused remedy which we used very less times. And there is so much to this remedy more than just some symptoms of arsenic and some symptoms of iodatum. Very recently, one very difficult, stubborn case of psoriasis I have cured with the remedy arsenic iode. This made me want to study this remedy at depth, and that's what I will discuss with you today about. So arsenic iode, we know it is basically a triiodide of arsenic. Clark writes, it's more indications of arsenic more than iodatum in this compound. So it's more chilly than hot. It has specific action on mucous membrane, nose, the digestive tract, lungs, heart, glands, skin. Skin is a very important action here. Heart also. Many old people, many old patients with cardiac issues, arsenic iode has helped. Left-sided remedy. Action on nerves. Chilly, aggravated by dry, windy weather. Worse by apples. Worse by smoke. Better in open air. Boger writes the main keynote is weakness, burning, and profuse acrid discharges, thin in acute and thick gluey yellow in chronic, with rawness. History of tuberculosis, consumptiveness is another keynote. One of the very rare homeopathic materia medica, Royal, has written very nice word to explain the constitution. Catarrhal and debilitated, which means the patient get recurrent cold and cough. Catarrhal, constant the nose discharge, constant the ear discharge. In fact, Kent has written in his provings that once one of the patient of nasal bone cancer, nasal bone disease in a young girl with developmental delay, the only keynote was thick yellow discharge, almost like honey. And on this basis, Kent has prescribed arsenic iode, and the child's mental development improved. You understand the importance of thick yellow discharge. This is almost like Kali-iod. So when Kali-iod fails, remember remedy like arsenic iode and sulfur iode. In fact, Morrison has written a lot about in his practice using arsenic iode in hyperactive children. So when tuberculinum fails, these children who tear doctor's office due to restlessness like tuberculinum think about arsenic iode, especially with history of recurrent cold and cough. Lippe has written a lot of importance to lymphatic. Wherever iodatum comes, the lymphatics get involved. I want to tell you some very cured cases. And Dr. L.B. Wells once cured a case of axillary tumor. The only keynote was very important: yellow, bloody, thick discharge of the leukorrhea. On this, arsenic iode was given. Another thing that I want to tell you is in cases of chronic psoriasis, chronic lichen planus, with large scales, many scales coming out, with bleeding underneath. Remember arsenic iode. In fact, there is one of the greatest homeopath, Erastus case. He had a very difficult case of psoriasis which was not getting better at all. A young girl, 17-year-old. The only keynote he found was there was a thick crust, but underneath there was a lot of inflammation. On this, he gave arsenic iodine CM potency, and within 4 months, the psoriasis just went away. It never came back. He required 2 doses to be given. The other thing I want to talk to you about in arsenic iode is the special action on heart. This is what I have observed as well. In many old old people's cases. I have a very interesting case of cardiomyopathy who also had interestingly very high BP, who was not getting better on any remedy, just on the basis of very strong tuberculosis and his typical nature of being very careful, cautious, fastidious, perfectionist. Where arsenic was involved, I gave arsenic iode because of the heart involvement, and remarkable result, remarkable. Massimo Mangioliori has spoken a lot about suspiciousness, strong suspiciousness. In fact, they are so suspicious, they are even suspicious towards their doctors, and they will not even take medicine. So, arsenic iode is more suspicious than arsenic. I have given this drug picture of arsenic iode, which I learned from Dr. Sarkar. His drug picture is as follows: when patient is very perfectionist, fastidious, recurrent cold and cough, fasting aggravates, very hot patient, with history of TB, with history of skin psoriasis, with heart weakened by COPD, first remedy to think is arsenic iode. So what I have understood, the main picture of arsenic iode in the cases which I have seen is strong perfectionistness, very strong suspiciousness, very hurried, impatient, they can't wait for the doctor's appointment, sudden impulses to say, do things, and tormenting thoughts troubling him. What should they do in that direction? One thing I want to tell you: arsenic iode should never be given after eating. It should always be given before eating, because it has been seen whenever it has been given after eating, patient have developed a lot of nausea and vomiting. Cardiac weakness. Remember, I use a very interesting keynote to use arsenic iode in advanced cases, cases of deeper pathologies, cases which are not responding to anything. When arsenic fails, remember arsenic iode. It is complementary to phosphorus. Remember this. In fact, it is said that once there was a case of conjunctivitis, influenza in horses. Arsenic iode helped. Lippe has given it as a complementary to Kali-iod, which is interesting. So, this was a short and sweet remedy, but very useful remedy. I wanted to share you because I wanted you to use this remedy and write to me. Thank you.